Okay, so the first, oh,
Sorry.
no, that's okay, I'll just have you lie down. So I'm gonna be taking a look at your nose and mouth today. So the first thing that I'm gonna do is look at the nose and just look for the shape, any deformities. I'm checking the septum to make sure that there's no septal deviation. And I see that the left nostril is just a little bit, different shape than the right, but that's okay. We have some asymmetry. So I'll be looking at the lips, looking for plumpness, moisture, their shape, etc. The lips look good. They look like they're a little bit dry, so maybe a little bit more water for the winter. So the next thing I'm going to do is take my otoscope. I'm going to be looking in the nose, and what I'm going to be looking for is the nasal mucosa pink. I'm going to be looking for the discharge, looking at the septum to see if there's any holes or anything like that in there. So I'm just going to be peeking in here, and everything looks really good and clean. Oh, I probably shouldn't. Probably need to go around my patient, so I'm going to look on the other side. Yep, and we have good. So everything looked good in the nose. Next what I'm going to do is take my gauze, and I'm just going to have you open up your tongue, and I will take the tip of the tongue, move it around. So I'm checking out the mucosa of the cheeks. I'm looking at the tongue to see if there's any discolorations. I'm also checking out the patient's teeth. While I was lifting, I was looking underneath the tongue at the sublingual glands, making sure that the ducts were open and there was good pinkness. Can I just have you stick your tongue out? Okay, so now I was just looking, checking to see, you can stick that back in, checking cranial nerve 12 and the part of the tongue that attaches to the floor, the frenum. So the next thing I'll do is ask my patient to please sit up. And what I'll be doing is checking the tonsils next. So I'm going to have them open. I'm going to depress the tongue. Can you depress your tongue? And I'm going to have you say ah. Everything was uniform there. So next I'm going to check cranial nerve 12. We're going to do a bite test on both sides. Everything was good there, strong. Open up, and I'm just going to test the gag reflex. Okay, we got that on the right. Sorry.
Very good.
Open up. And we got it on the left. Okay, good strong gag reflex on both sides. So next what I'm going to do is check the maxillary sinuses for any blockages. So I'm just going to press down and let me know if there's any pain. I'm going to press up, and we're checking for pain as well. I'm going to check the ducts to see if they are blocked. So go ahead and look up for me. Everything looks open there. Next thing I'm going to do is apply a little bit of pressure to the lacrimal sac. And if there was any buildup, there would be some squirting at me, which everything seems to be fine. So we know that the fluid is draining back into the sinuses. So all of that is good. We already checked for cranial nerve 12, 11, and 10. Lastly, to note, the patient did not have any halitosis or abnormally bad breath. So everything looks great. Thank you.